I think it was a challenge. It was the challenge to carefully build up a tailor-made treatment for our clients from scratch, to choose the right people, to understand the client's needs, to have this conversation. What are their expectations? What is our expertise and what is our experience with treating some issues? And then this kind of teamwork where we also invite the clients and exchange our views and approaches and get the best strategies which are really working. Individuals who are looking for our support, that they have an understanding what is going to happen to them when they're in treatment. When I first meet you here in person in one of our beautiful villas, then ideally I already know you. So there is this so-called
of me.
A lot of things of you, and we are also in touch before you coming to us. So there is this so-called pre-admission phase where we carefully collect already medical information, lifestyle information, either through you directly or through your loved ones. And ideally, we also have a remote phone call, a video call, where I get to know you. So on the day of your arrival, you already feel that you know the people, or at least some people, you're going to work intensively with during these couple of weeks of treatment. And this is very important to, first of all, talk about expectations already before you arrive, have some kind of common understanding what's going to happen, and feel already a bit familiar with at least some of the team members. This is what we call kind of you're in a home away from home and still receiving some treatment. So this is kind of a hybrid model of being in a clinic or being in some kind of well-being center, and also being home or on a holiday. So it's as you said, it's very important that we have a common understanding what we're doing here, and we give our clients guidance. So we have this responsibility to guide our clients, and even with very small interventions like selecting the place of the treatment or the place of a talk therapy, we can set some boundaries and set some rules. It is important that there is an adequate setting for these talks, because it might get delicate, it might get intense, it might get emotional, and then you have to feel safe and not exposed. And to separate activities, behavioral patterns, is also important that you learn that dining table is rather for eating or enjoying the social contact with family or loved ones, and the treatment room is for treatment. So that is one example how, through choosing the right physical setting, can protect. We have patients who find this very difficult, this kind of, we call it frontal, very direct situation. Of course, we adjust. That means we can go out for a walk. That makes most of the people much easier to talk about even difficult topics. We do have tricks, so to say, to ensure that our clients feel comfortable with these kind of talks. We have a larger group of doctors who are ready to do their medical check-ins even on a daily basis. So I see my patients every day, or maybe even twice a day, to monitor and follow up the progress. We try to understand health issues, health conditions in their complexity. We don't want to simplify it too much, because we have an understanding that, for example, what you mentioned, sleep disorder, anxiety, of course, sometimes the roots or the causes of these disorders are very clear at the first sight. Our duty is to go into the details. And when it comes to the therapies and our treatment strategies, they also have to be adjusted to the individual. They have to be, so to say, translated to individual, because what you find in books, it's very important, and we are an evidence-based institution, so we do follow the international treatment guidelines. But probably also you experience yourself, only reading something on the internet, for example, or listening to a doctor what to do or what not to do might not even help you in your everyday life. So our mission is to translate these messages, these strategies to the individual level and initiate a real change. What we are doing needs a lot of communication, a lot of exchange of ideas. So what you might not see when you're a client here in our residential treatment, that in the background there are meetings after meetings, because this information, what we get either in the sense of a result of a lab or some examination, or our observations, these information are put in one pot, and then all the doctors and the specialists sit together around this pot and they analyze. They set new strategies or adjust strategies continuously. So this is so to say the background work, which might not even be so apparent to our clients who are in the villa and having all the treatment elements. Fortunately, there are new methods we can integrate in our therapies. Just want to mention, in treatment-resistant depression, we have an old new substance called ketamine or esketamine. It has qualities that really help ease the severity of the depression in humans. That is one of the novelties from the last couple of years. What I really want to emphasize here, that I don't want to put people in a position that they build up too much hope about these very new approaches, because although it gives hope to a lot of people, but it's not for everybody. We are still at the Kusnacht Practice being humble and still believe that going back to the basics and carefully analyze the pre-existing results and listen to the client and collect a very detailed history from the client. The breakthroughs from the last years can give hope to a lot of individuals. It's also important to understand that it's not for everybody, and we still have to always go back to the basics of medicine. Certainly, most of the mental disorders, but also somatic disorders we are treating are so-called chronic illnesses. The illness comes in phases. There are better phases, there are worse phases, and we have to be ready when there's a phase where the clients need more support, and there are phases where they can live their life without any relevant impact from their chronic disease. We think long term. That is very important, that we don't believe in quick fixes. Most of our problems are having a chronic nature. What we are doing here is also activating the inner resources. That means we improve people's skills, and we are putting more skills in the basket. So we increase the repertoire of these coping mechanisms. What we also working with is values, to see what is driving, what is motivating the individual, because the fact that you have skills in your basket does not mean that you are keen or interested or having the motivation and energy to use them. So in our treatment, if our clients allow it, we go sometimes deeper and ask the question, why are we doing this? Why are we fighting for? Even if you gain health here and stabilize, what would you like to do with your health? These are very important questions. Because health is only a value when you can, as you say, integrate it in your home environment, when health and functionality or improved or restored functionality has a place in your original environment. I'm throwing in empowerment. What makes me the happiest doctor when I see that my clients begin to feel that they are in control of their lives. They can do something to improve their lives or stabilize their lives, decreasing the level of dependence, depending on other people, depending on substances. What I feel that is very important is education. Educate yourself, reach out to professionals you trust, and don't worry about starting a treatment or having to do changes in your lives. That might come in a different, in a later phase. Just pick up the phone or ask someone, start to ask questions, start to develop this curiosity, this openness, and that is already a lot. Start a dialogue. And then whether it will lead to a treatment or whether you have to change something in your life, don't worry about that. That might come later or might not even be necessary. But this mindset, what you say, to acknowledge that there are issues which might be bigger than me, and that there might be others out there who know about this, who I can share my views about this, share my suffering, share my ideas. It's very important. And if you don't have that kind of environment in your home country or in your family, then there are the professionals that you can reach out to. Again, maybe only to receive information or start a conversation. Is this an illness? Am I healthy or not? How is it with others? Some individuals might not know what kind of issues others have, right? Because we're not really talking about these. We might be ashamed of our problems, of our fears, of our lifestyle. And that's why professionals are there to support. They have a very neutral attitude, right? They don't judge. They know people with similar problems than you, and they can provide you some information. This is very important, and I think we are talking first of all about happiness, how happy and satisfied you are in life. If I translate that to the language of psychology, I would say we're talking about functionality. We are talking about agency. We are talking about empowerment, how much control you have over your life, how much you can act in your life and reach your goals.